everyone, my name is Sheila Trinidad. Today I'll be discussing the 5 W's: what, who, where, when, and why, about the stigma surrounding mental illness. With that being said, we'll look at who is affected by the stigma, how it impacts individuals, and the systemic biases that contribute to it. I'll also highlight some current initiatives aimed at reducing this stigma. Stigma refers to negative attitudes, beliefs, and stereotypes people hold towards those with mental health conditions. This stigma can prevent or delay individuals from seeking care or cause them to discontinue treatment. There are three types of stigmas: public stigma, self-stigma, and structural stigma. Public stigma refers to society's discriminatory attitudes and beliefs towards mental illness. Self-stigma defines the internalized negative attitudes, including shame, that individuals who have mental illness may possess regarding their own condition. Structural stigma is more systemic, involving policies of government and private organizations that intentionally or unintentionally limit opportunities for people with mental illness. Examples include lower funding for mental illness research or fewer mental health services relative to other health care. The impacts of this stigma are social exclusion, where people with mental health conditions may be excluded from social groups and activities. Discrimination, they may face discrimination in employment, housing, and healthcare. And delayed treatment, which is a fear of stigma that can prevent individuals from seeking help or cause them to stop treatment. People often avoid or delay seeking treatment due to concerns about being treated differently or fears of losing their jobs and livelihood. That's because stigma, prejudice, and discrimination against people with mental illness are still very much a problem today. Stigmas about mental illness make it hard for people to get better and feel well. According to the article Breaking the Stigma, Destigmatizing Mental Illness, using data from 5,521 respondents, by tracking happiness, 88% of the people you meet have been struggling with at least one mental health issue over the past year. Stigma is a big reason why many don't seek help. It affects more than just mental health. It also impacts job opportunities, forming relationships, and overall quality of life. There are many harmful effects of stigma and discrimination. Some examples of harmful effects of stigma and discrimination include reduced hope, lower self-esteem, increased psychiatric symptoms, difficulties with social relationships, reduced likelihood of staying with treatment, and more difficulties at work. The bar chart on this slide, titled "What Mental Health Issues Have You Experienced Over the Past Year?" shows the frequency of various mental health issues reported by 5,521 survey respondents. According to this chart, the most common issues are stress, anxiety, and low self-esteem, with stress being the most frequently experienced. Other significant issues include constant worrying, depression, loneliness, and sleep problems. Less common but still notable issues include emotional instability, social isolation, anger, negative body image, and lack of attention. This chart highlights the wide range of mental health challenges people face, emphasizing the need for comprehensive mental health support and resources. Individuals with mental illness can include anyone of any age, gender, ethnicity, social status, or geographical location. Groups and individuals who contribute to the stigma surrounding mental illness are family members, peers, employers, educators, and healthcare professionals. Policymakers and media figures are also crucial stakeholders, as they can shape public perceptions and influence policy based on their words and actions. The bar graph on this slide, titled "Prevalence of Serious Mental Illness Among U.S. Adults by Sex, Age, and Race in 2008," examines how common serious mental illness was among U.S. adults in 2008, divided by sex, age, and race. Overall, more women had serious mental illness compared to men at approximately 5.5%. Young adults aged 18 to 25 had the highest rates at 8%, while older adults aged 50 and above had the lowest rates at 2%. Among racial groups, American Indian, Alaskan Native individuals had the highest rates at 10%, followed by people of two or more races at 7%. This information highlights differences in mental health across various groups, suggesting the need for specific support and help for these populations. Bias against mental illness is embedded in the system and expressed in various ways, often leading to significant barriers for those seeking help. In structural stigma, we have underfunding of mental health services, where mental health services often receive less funding compared to physical health services. Inadequate training, where healthcare professionals may lack training in culturally responsive and trauma-informed care, and discriminatory policies, in which laws and institutional policies may embody stereotypes such as limiting employment opportunities for those individuals with mental illness. In public stigma, we have media representation, where media often portrays individuals with mental illness as dangerous or unstable, reinforcing harmful stereotypes, and discrimination in employment and housing, where employers may be reluctant to hire and landlords may be unwilling to rent to individuals with mental illness. In self-stigma, we have reluctance to seek help, in which the fear of being judged or treated differently may prevent individuals from seeking necessary treatment, and internalized shame, where people with mental illness may believe they are to blame for their condition, leading to feelings of worthlessness. In interpersonal stigma, we have discriminatory behavior, in which healthcare workers and mental health professionals may exhibit discriminatory behavior towards patients, and lack of empathy, where patients with mental illness may be made to feel less than and receive less empathetic care. Finally, in systemic bias, we have healthcare. It's a bias in healthcare can lead to misdiagnosis or undertreatment of physical symptoms, attributing them to mental illness. And cultural factors. In some cultures, seeking help in mental health may conflict with values like family honor and emotional restraint. People with serious mental illnesses, such as schizophrenia and bipolar disorder, often face a lot of prejudice. Racial and ethnic minorities and those with lower incomes also experience more stigma. Unfortunately, bias in the healthcare system affects how these groups are treated. For example, doctors might mistakenly think physical symptoms are due to mental illness, leading to incorrect diagnosis or insufficient treatment. Mental health issues in marginalized communities are often ignored or minimized, while cultural and historical factors add complexity. Mental illness stigma is a pervasive global issue affecting individuals across various cultures, social, and economic contexts. In the United States, stigma and discrimination related to mental illness occur in numerous settings, including workplaces, schools, healthcare facilities, and communities. In workplaces, individuals with mental health conditions may face discrimination in hiring practices, job retention, and workplace interactions, often due to biased views about their capabilities. Schools present challenges such as bullying and exclusion, impacting students' academic performance and social integration. Healthcare facilities can also be sources of stigma, where discriminatory practices prevent individuals from receiving adequate care. Communities vary in their acceptance of mental illness, with some being more supportive than others. This societal stigma can also lead to social exclusion and isolation. The impact of stigma includes barriers to treatment, as fear of judgment and discrimination can deter individuals from seeking help. Combating stigma requires education and awareness to promote understanding and acceptance, as well as supportive policies that reduce barriers in various settings. Addressing mental health stigma is crucial for improving mental health outcomes and fostering a more inclusive society. The graph on this slide, titled Perceived Knowledge of Mental Illness, illustrates how much an individual believes they are informed on the topic of mental illness, labeled in red, as well as how informed they believe others are, highlighted in green. It shows that 20% of individuals believe that they are slightly uninformed, while the highest 43% of individuals believe that others are slightly uninformed. On the other hand, 19% of individuals believe that they are very informed, while the lowest, being 2% of individuals, believe that others are very informed on the topic. This graph highlights the mixed and often conflicting views on how individuals believe their knowledge as well as others' knowledge on this topic. Individuals generally feel more comfortable discussing mental health with friends or family rather than with employers. This bar graph, titled Level of Comfort Discussing Mental Health, compares how comfortable individuals feel talking about mental health with friends or family members, labeled in green bars, versus current or prospective employers, labeled in red bars. As seen here, 10% of individuals are uncomfortable speaking with friends and family, while 50% of individuals are uncomfortable speaking with employers. 6% of individuals are neither comfortable nor uncomfortable speaking with families and friends, while 18% of individuals are neither comfortable or uncomfortable speaking with employers. And 2% are very comfortable speaking with families and friends, while 5% are very comfortable speaking with employers. Efforts to address mental health stigma involve various policies, organizations, and individuals. Key initiatives include the Mental Health Parity and Addiction Equity Act, which ensures equal insurance coverage for mental health, and programs like Mental Health First Aid that train people to recognize and respond to mental health issues. Organizations such as the National Alliance on Mental Illness and Mental Health America, who work to educate the public and advocate for mental health. Experts like Patrick Corrigan and advocates like Luna Greenstein are also active in reducing stigma. Public education campaigns, supportive policies, and responsible media representation are crucial in changing perceptions and supporting those affected by mental health issues. Other policies, programs, and organizations that aim to address mental health stigma include the National Consortium on Stigma and Empowerment, which is a group that focuses on research and advocacy to reduce stigma and empower individuals with mental illness, as well as Help Guide, which is a nonprofit that provides extensive information and resources on mental health. Individuals who advocate against this stigma include Patrick Corrigan, who is a leader expert in the National Consortium on Stigma and Empowerment program, and Luna Greenstein, which is an advocate who writes about ways to fight mental health stigma, encouraging open conversations and education. Efforts to reduce stigma include the public education campaigns, which are organizations that run campaigns to educate the people about mental health and reduce stigma. Supportive policies, which are the policies that support people with mental health conditions in workplaces, healthcare, and housing, are crucial, as well as media representation, who are responsible for the media portrayal of mental health, which can help change public perceptions and reduce stigma. The ultimate goal is to break down barriers that prevent individuals from accessing mental health care and support, leading to improved mental health outcomes and quality of life for those affected. By understanding the root causes and consequences of stigma and discrimination, society can work towards encouraging empathy, reducing fear, and promoting inclusive and supportive environments. Addressing mental health stigma requires a multifaceted approach. I believe that increasing public education and awareness is crucial. Campaigns that share personal stories and highlight the realities of living with mental illness can help humanize the issue and reduce stigma. Additionally, implementing supportive policies in workplaces and healthcare systems can ensure that individuals receive the care they need without fear of discrimination. I agree with these suggestions, particularly with the importance of training programs like the Mental Health First Aid and the advocacy work done by organizations like NAMI and MHA. These efforts are essential in creating a more inclusive and understanding society. Finally, a few other organizations and campaigns that support mental illness and stigma are Stop Stigma Together, which unites organizations to create resources, fund solutions, and raise awareness on mental health and substance use disorders. This challenges everyone to end stigma and promote well-being, as well as Healthy Minds, which aims to destigmatize mental illness and show hope through help. It also features personal stories and expert insights on psychiatric conditions, therapies, and research, produced by the Brain and Behavior Research Foundation. And lastly, we have Love Your Mind, which provides inspiration, community, and resources to encourage proactive mental health openness across the U.S. Thank you for watching this video. I hope it helped you learn and understand the stigma surrounding mental illness. For more information, please visit the resources listed below that were used to create this video.